Welcome to this year's Continuous Professional Development Workshop being organized by PALI, Passionate Africa Leadership Institute. I am a professional banker. I'm also a career counselor and a corporate trainer. And I also do workshop facilitation. I have done this for well over 20 to 25 years. So learning new techniques for your professional work is like the fish that provides a meal for you today. When you learn the new techniques, it is for today. If you don't reflect on it, then you are doing yourself harm. But when you do reflective practice, it's like the fish net, the net, that provides the meal for the rest of your life. Look at that. So reflective practice is very, very important. You know, it has so many advantages. It can be used as a guide for your further actions. It can be used for you to have informed actions. And it can be used to be able to justify and explain yourself to your superiors, or even to your team, or to your subordinates. Once you reflect and you go through the reflective process that we have been outlining today, it gives you the confidence to be able to explain why you did what you did, why the team did what they did, why the team should change what we did. It allows you, the allied health professional, to adjust and respond to clinical and workplace issues. The more you do the reflective practice, the more you get the confidence and more better ways to do things, and therefore you can adjust and respond clinically to workplace issues. It helps you, the allied health professional, to become aware of underlying beliefs and assumptions at your workplace. It will help you to promote a positive working environment. You acquire new knowledge, and you improve your understanding and connection between theory and practice. There are many more, many. So let us take reflective practice as a key part of our lives. Key part of our lives. And as I said, it should not only be for your profession. You can even do reflective practice on your home, on your personal growth. It will give you a better understanding of yourself. It will give you a better understanding of your strengths and your weaknesses when you document and reflect on things that have happened in your life. It will give you an increased sense of strength and autonomy, competence and control at your workplace. It will make you more confident. It will increase your motivation to act because you've reflected on this process and you have found better ways. And ultimately, it will improve your clinical performance. It will improve your clinical outputs. It will show you how to take action in a more effective way. And so on and so forth. So when we talk about clinical competence, because at the beginning we said reflective practice and enhancing clinical competence. So when we talk about clinical competence, we are talking about your knowledge, your skills. You can reflect on each of them, your knowledge, your core academic knowledge, technical knowledge, your skills. Reflect on your attitudes. Reflect on your values, which we shall see more in the next session where ethics comes in. Reflect, know your experiences in specific clinical situations. And how do you demonstrate clinical competence? When your knowledge, skills, attitude, values, experience, etc., they are accurately The key word is accurately applied at a workplace situations or workplace situation. And where appropriate behaviors and judgments are consistently, that's the key word, consistently displayed. Because you know that you have reflected. You are not doing it just because you are there in the health institution, you are there on a particular place, but you are doing it because you have thought about it, you have reflected, you have documented, you have analyzed, you have evaluated, and you have put an action plan to improve wherever a similar situation comes about at your workplace. So that at the end of the day, you have improved effectiveness, improved efficiency, higher job satisfaction, clear professional growth, increased team collaboration, overall team and organizational or institutional success, and reduction in mortality and clinical risk and deaths, etc. It has immense, and so these are some of the examples that we want to look at. You can have after operations complications. You can even have before operations complications. And you see that in the case studies that we will leave you for today with. You can have misdiagnosis. So these are things, most reflections are things that go wrong, and these are examples. You can have a dissatisfied patient. You can have a failed procedure. So these are things that would continuously go wrong in allied health professions. Pre-operative complications, during operation complications, post-operative complications, when even patients have gone home. You have misdiagnosis, dissatisfied patient, and so on and so forth. But you can also have reflective practice when things go right. So these are examples from allied health professions or medical, where things go wrong. But you can also have where things go right. Example, where you have a well-managed cardiac arrest. Somebody has a cardiac arrest, and all the allied health professionals join the doctor and the nurse and are able to get that arrested. It can even be an interesting seminar or conference, as we said, or a workshop like this one. You can reflect on it. What did I get out of it? What happened? What can I do more? It can be a patient thank you letter. So for goodness sake, what we are saying is that reflective practice is huge. It's everything. It's everything can be reflected on. At the end of the day, it is everything that can be reflected on that will improve your practice, improve your outcome, improve patient outcome, improve your organization's outcome, improve the well-being of everyone in Ghana. It can be a difficult but well-performed procedure. All these are positive. So there are negative ones, positive ones. You don't have to say, I'll only reflect on the negatives. You can reflect on the positives and see how you can even become more positive. It is possible to engage in reflective practice as part of shared activities with a group, as we said. You can share it with your team as well. And it has many advantages and disadvantages. Okay? Right, so we have learned so much for this session on reflective practice, and it's so important for clinical competence and clinical outcomes to all of us as allied health professionals in various ways. And so we are ending with a couple of case studies, and as we said, you would access these case studies. What I want to stress on is that let's look again at the professions under allied health. What I want to stress is that there are so many of individual professions. And the good thing about we, the allied health professionals, is that all these in various clinical instances or cases or situations come together. So you can have medical laboratory science coming together with the nutritionist. The health information and record management is key for virtually everything. You have speech therapy where somebody post-trauma would require that, the speech therapist may have to work with the physiotherapist. The physiotherapist would have to maybe start his work after the prosthetics have put the legs or the orthotics have been done. So we are each other's keeper. And so it is in that case that I want us to look at the case studies. And then we have, based on the case studies, we have our final practice assignment. Our final practice assignment. And take note that the practice assignments were put in intentionally in order. So the practice assignment 1 to the 2 to the 3 to the 4. And so with this fourth one, we are saying that based on the samples of case studies on reflective practice, as you would have seen once you click the button. Now, based on these samples, look again at, or should I say, review your output so far from your practice assignment 3. So that practice assignment 3, we asked you to try your hand. Now we are looking at some case studies, and that should help you to go back to your practice assignment 3 and see how you can improve on that. So go back there, see on how you can improve your answers or outputs from your practice assignment 3. You're okay. So go press on the button, and then the case studies will be there to help you to answer your assignment 3. At the end of the day, all we are saying is that everything we do with continuous professional development, everything today for this session that has to do with reflective practice is to urge us that don't just work for work's sake. Please, let us not work simply because at the end of the month we will earn a salary. Let us work as allied health professionals because we care for humanity, because we care for our patients, because we care for our institutions. And therefore, the question that we continuously ask year after year when you attend the Pali CPDs, the question we keep on asking, and we will continue to ask, just as the picture shows, are we safe with you as allied health professionals? Can we, the patients, the families, the people of Ghana, trust you, allied health workers of Ghana? And I want that to go deep into us, even as we sleep, when we wake up, when we sleep, when we wake up, when we are at our workplaces, when we are performing various cases of healing. This is what we should be thinking about. So that we will do it reflectively. We will do it with a mind to improve. And that is the essence of the Pali CPDs. And so with that, we say thank you